I'm oral historian Mike Chappell. Today, June 15, 2008, I'm interviewing Dr. John Potts for the Endocrine Society at its annual meeting being held this year at the Moscone Center in San Francisco. Dr. Potts is a past president of the Endocrine Society and is a member of the National Academy of Sciences and of the Institute of Medicine. Dr. Potts has been a pioneer in parathyroid hormone for over 40 years. His fundamental contributions resulting ultimately in FDA approval of parathyroid hormone therapy for the treatment of osteoporosis. Currently, Dr. Potts is the Jackson Distinguished Professor of Clinical Medicine at Harvard Medical School.
I've stayed working on parathyroid hormone my entire career because the field of interest has magnified underneath the concept of parathyroid hormone.
And what were your most significant contributions in the field at this time, in your NIH days?
Well, we learned how to isolate the material in high yield. We learned how to do the structure. We were moving very well in late 1960s when I was there. We had part of the structure worked out, but it was still very laborious. And there, we then had the problem, if the structure was correct, the only way you prove a structure is to synthesize it. And at MGH, we did do solid phase synthesis, Tregear did, and the material was active, but in a bioassay that had been developed by Auerbach, and we were all very excited, and we had achieved the structure. We must have been correct because it was biologically active. Osteoporosis was known to be a very troublesome disease that many patients, if they lived to be older, over 60, particularly women, would get this loss of bone mass and lead so to the state where the bones were no longer strong enough to support their weight, and they would have what are called fragility fractures. But there weren't any treatments for it, and there weren't any techniques for measuring bone mass that were really very accurate, so that you didn't know you had osteoporosis necessarily until you began to break bones, and then they all would break pretty quickly, one after the other. And Parsons had noted that Albright, who had been the chief of the unit so many years earlier that I came to at MGH, had done a study in rats and showed that a daily injection of parathyroid hormone, if you just did a little squirty injection for a few hours, that Albright noted in rats that he was studying for another reason we didn't get into, that it built bone, didn't break it down. And he said, you know, we should try parathyroid hormone as an agent for osteoporosis. Well, since there wasn't anything around for that, we tried it, and that story went on for many years, but it proves to be a paradigm-shifting development in which it builds bone for reasons that are paradoxical when you understand its role in biology, but which may be explained in other ways we now have some insight into. And it was a wonderful development. So parathyroid hormone moved from the calcium thermostat to a critical agent in bone health. And that's been the dominant paradigm now.
And what were the therapeutic results of this?
The therapeutic results were very, very striking. Parathyroid hormone, when given, we learned early on, to patients with osteoporosis would build bone back up. Others began to study it and excited by it, and the methods were then getting better and better to evaluate what was happening. And so there were a number of clinical investigator-initiated studies, and finally Eli Lilly Company said, we can handle this without a patent. They came in, developed the drug, and it's been approved since 2001. It's now about a little under $1 billion a year drug internationally, and it's been very, very helpful in treating patients with osteoporosis.
What opportunities do you get to network about this or discuss it further?
Well, I think it's an excellent question. These meetings, like that of the Endocrine Society or this so-called sister institution, the American Society of Bone and Mineral Research, are great meeting places where people from all over the country and from abroad, from both Asia and from Europe, come together, and there's a set agenda where people are invited for the program committee who has to prepare all this some time in advance. They give research talks, formal and informal, different formats, And there's great intellectual stimulation, and people ask questions, and you can see a vast sea of intellectual effort being stimulated by this meeting. And there are many sessions in this meeting on the bone field. But of course, I like to go also and listen to things that my colleagues are doing in other areas, in steroids and in reproductive endocrinology. So you get stimulation by listening to what's happening in your own field and what's happening in fields that might be not directly related, but in which you may sense another paradigm shift or a way in which people think differently about things. So it's a tremendous stimulation.